Right, here we go, as quick as possible. As you can see, that's the time. It's live now at that time, so I'm just learning how to do this. Okay, there we go. Click. Right, let's see what we're doing. Is that on screen? Can that be seen? Alright, so what I'm going to do is quickly flick through this. It's 11 o'clock on a Sunday night, and right, Professional Acu-Stim Practitioners Course, the Acu-Stim Treatment and Training Course, created by the author Nick Segal. So first I'm going to do a warm-up exercise, then we're going to complete a pre-course questionnaire, then we're going to discuss who are you. You're going to ask yourself, who are you and why are you here? So you ask yourself, who am I? Next slide, Professional Acu-Stim Practitioners Training Course. It says there, aims and objectives to improve physical, emotional and social well-being through the reduction of stress by allowing relaxation in and causing no harmful side effects. How? By utilising the latest technology in biopsychosocial treatment and training called Acu-Stim. I called it Acu-Stim because it was called electrical stimulation therapy, and that was just freaking people out. It comes from that, you know what I mean. The history is long, you know what I mean. It goes back to Meg Patterson in the 70s, who was treating pop stars like the Who and all that. Alright, outcome: providing advanced practical skills for personnel working within the fields of health and social care. Next, aims and objectives continued. Provide skills training to enhance mental health, psychological and emotional well-being in line with natural law. Okay. We're promoting an empirically tested, science-based, holistic healing for addictions, traumas, and all areas of cognitive, mental, and behavioural health. Little quote here that I added. In another and better world, things may be different. But, however, in this world, to grow is to change. And to have changed often is to have grown much. And that was said by Arnold Newman, apparently, ex-slave. Takeaway skills. What you will get on this Professional Acu-Stim course, level 2. Professional is practical skills. Right, next. So what you'll be able to do at the end of the course is list the safe and unsafe points or places to apply Acu-Stim. You'll be able to locate Acu-Stim points accurately. All these points were based on the National Open College Network's criteria, which they passed it ages ago. Learning outcome 1, you'll be able to use an Acu-Stim pointer correctly. You'll be able to apply treatment according to Acu-Stim protocols. You'll be able to demonstrate, understand and explain the correct frequencies of Acu-Stim treatment that are used to produce a natural antidepressant and or sedative effect by stimulating the release of neurotransmitters. Excuse the voice, keeps changing. Right, learning outcome 2. The learner is able to understand the use of Acu-Stim. I don't even know. Are we recording? Don't know. What's that say? 1 minute 11. Alright, let's keep going. So, we've got hyperactivity, severe sensitivity, sweating, shaking, diarrhea and nausea, anger, fight, flight and panic-like symptoms. I'm reading it exactly as it is, you know, for people like me that couldn't read and write, so I've only just learnt this skill of deciphering the symbols or the spells, right? And B, hypo, meaning low, activity, constipation, no energy, depression, low mood, lethargy, freeze-based symptoms. And the third one, hyper, mixed mood, swings up and down, bipolar-based symptoms. Okay, Assessment criteria. The learner has achieved this outcome because she can explain the frequencies used and the rationale for using them when treating conditions related to A, B or C above. Learning outcome 3. You'll be able to explain the conditions that make Acu-Stim unsuitable or dangerous. 4. You'll be able to demonstrate and carry out a full treatment and complete all records, admin correctly, applying all protocols and procedures while being observed. Right, next. The course is 4 days of focus. Obviously, you'll be treating each other, so the treatment helps. You're actually getting treated for 4 days while you're doing it. You're treating yourself and other people on the course. Small groups, obviously. 4 is a nice number. 6, 8, done 10s in Ireland. We had some big courses. Alright, 12s. Alright, so whatever it says there, I can't bother. On satisfactory completion, yeah, you'll be accredited. Rules, obviously 4 sessions, usually Tuesday to Friday, 10 to 4. 6 hours of practice each night. The idea, promote freedom, ensure equality, be considerate, ask questions. Confidentiality is paramount and mandatory. It's very important. Right? So what's said in the room stays in the room, otherwise how can people be themselves? So, and we're all responsible for our own responses, our own learning outcomes, thoughts, feelings, words and actions. Right? There's no blaming, there's no excuses. Bring it back to yourself. Alright. Have I missed any out? Alright, background, history, the last 25 years. Research and development of this particular treatment and training began formally when the author approached the NHS, Substance Misuse and Mental Health Services in Greater Manchester, GMMH, thereby making this service available to their clients and staff from the year 2000. This is all verifiable and checkable. Right, it was nationally accredited in 2004, and in 2015, while I was over in Kanata, I developed the self-treatment course, basically. Neurodiversity, 2016, did an evaluation of the therapy, treatment I call it, at the Dyslexia Foundation in Liverpool. There's still a video up if it's around, and this treatment can be used for so many applications within post-traumatic stress, attention deficit, hyperactivity, autistic symptoms. Believe it or not, I've had all those labels. Alright. Done a lot out in the Gambia with the Gambian Drug Enforcement Agency and various charities. Actually, it was called First Gambia. No, it wasn't. Forgot the name. Anyway, I worked with the Gambian mental health hospital owner, the prisons, the addicts on the street, and social services. They all loved it and wanted it, but obviously funding wasn't available. So back in the UK, I was trying to do a crowdfunding thing. Anyway, here we are now. Cravings and feelings. Right, so we do craving scales before, during and after treatments, measures. We're going to look at what is emotion, what is feeling and what is thinking, who's in charge. So we're going to look at what are thoughts made of, words, sounds, symbols, pictures, smells, ideas and opinions that pop into your conscious mind. Conscious means now, present. You're not thinking about the past or the future, you're here right now. 3, 2, 1, back in the room. Next. Feelings and emotions. Okay, this is all the teaching on the course, which most people know or not. But, this I can teach from anybody from the age 7 to 70 plus. Right, I'm saying 7 because the nervous system's usually fully developed by then, and also the programming. So we can undo all programming during the treatment. So, next, we'll look at the dopamine pleasure pathway. This is all like the neuroscience, the biological stuff. The nucleus accumbens, and the mesolimbic dopamine pathway. So we're going to look at how it affects the brain. bit more amygdala hijack. So we're going to bring some intuitive thinking skills into this, how to deal with your thoughts and feelings, the difference between your human brain and your animal brain, how to deal with those thoughts. Okay. Next, why use Acu-Stim? Because it's safe. It works biophysically. In other words, it treats the body and the brain and the mind. It's biophysical. We're using TCM, that's traditional Chinese medicine, the meridians. Yeah. We're going to cover certain master acupuncture points on the course. This is going on to biochemically, we're just talking about the speed of the pulse, neurotransmitters released, action potentials. Anybody that's studied a little bit, we can look all this up now on the internet, as they call it. But make sure it's true. The only way you know is to have your personal empirical experience yourself, right? So we're looking at frequencies. Oh, this is from Erickson. He gave me his permission. If I mention it, Erickson over in the States, the addiction science master. This was back in 2004. He emailed me back and asked him if I could use this cartoon because it's a really. I'm not going to explain it all now, but you do that. I haven't missed it. So look, quick, stimulated neurons. Then protocols and procedures for the course. Yeah, it's very good. Right, next. Yeah, so you got 9. Recommend level 1. So this is what you go through with your client or your mate or whoever you're treating. Whatever you want to call them. People, I call them. Here's the box, my new latest one. This is my 2025 box. And Acu-Stim treatment and training. Okay. So first we're going to set up we're going to teach you how to use how to set the equipment up. Then we're going to practice on yourself using the handheld copper rods, baby models the ear, auricular self-treatments, treating your ears, using the pointer probe, auricular map and mirror. Alright, that'll be all on the course. There's the upside down baby model with the head at the bottom. Check it out. Is it true? Yes, everyone's got one, but you need to know when you press on certain points of these ears, it will affect certain organs in your body. Here's the map. Oh, thank you. Yeah, she gave me permission to take this photograph while she was having a treatment, and obviously I didn't do the black dots on her ear, they were superimposed afterwards. Right, okay. Remember, this is all just done without any professional help. So we've got auricular points 1 to 4. Excellent. We cover 14 points. We cover all these points on. If you looked at the videos before of how I was treating myself, you'll have a good idea. These are all well-known traditional Chinese medicine points for auricular acupuncture. I was also trained with NADA, the National Acupuncture Detoxification Association. I can't speak properly sometimes. Okay, here we go. Points 9 to 12. What else? 13 and 14. 14 points you're going to be taught and practice on. Practical 2, we're going to locate and treat points. So it's a practical course. And we cover this. I'm going to go even faster now. Day 2, this is what we do. Large intestine 4, hand point. Stomach 36, knee point. Spleen 6, ankle point. Liver 3, foot point. That's my foot, by the way. Okay, what's the difference between your left foot and your right foot, I would say. Spleen 1 and 2 on this diagram, big toe point. Antidepressant points, okay. Day 2, practicals. Day 2, more practicals. So we cover, right? Practical 6. We get lots of practice on each other. Then we have a quiz. I call it a quiz because I don't like the word exam, but that's what they are. What are you're going to learn? You're going to know these answers off by heart. What are the 2 main contraindications for this treatment? What frequency should be used? Nicotine, cannabis and heroin withdrawal. What does it look like? Is it hyperactive and symptoms and expressions? You don't have to have the drugs to have the symptoms. Right, question 3. What frequencies should we use for hypoactivity expression, suicidal, addict, depressed mood? What does amphetamine, cocaine, crack and stimulant withdrawal look like? Okay, very similar. You don't need to be on drugs. If in doubt, what frequencies should be used at first? You're going to learn all this, you're going to practice it. What is the treatment protocol? How could polydrug use present itself? These are all just questions. How high should the intensity be? I'll give you that one. It's called, as soon as you can feel it, sensory perception. Question 6. How long should a treatment be? Maximum length? One session, we're on about the pulse frequency. It's 30 minutes maximum laying down. But you need to allow an hour for each session. Because it's the beginning, the middle and the end bit. Alright, so half an hour. You can, what point does the time begin? Blah, blah. When should you not begin an Acu-Stim session? 3 major points, obviously. Indwelling cardiac pacemakers, pregnancy, and the third one, if in doubt about anything. If you feel in doubt, don't do anything. Do not. If in doubt, do not. Right, next. How long should you treat the auricular points for? Between 30 seconds and a minute. Name the acupuncture points. More importantly, you can show me. You don't have to remember anything. You don't have to be able to, you don't even need to read and write for this course, because I will explain it all physically, mentally, with pictures. Alright, question 10. Do you feel confident to treat yourself? So that's basically, I've summed the whole course up in 10 questions. And that's it. You learn all that by day 2. Remember, you've got 2 more days left of the intensive course. Day 3, always start with a recap, last night reflections, keeping, Then we get into it. Assessment protocols. You're going to learn all the admin stuff. Consent form signed. You're going to check your contraindications. We're going to do 10-point scale assessments. Right? There's 10 different questions that will inform you of where to put what points to treat and what frequency to use. And you need to explain why you chose such a thing. Hyperactivity, then we do role playing, hyperactivity, hypoactivity, then we do mixed, polydrug, whatever you want to call it. Alright. Day 3, we're going to have a written exam. It's the 10 questions. Right. You'll have a fully illustrated manual. Right. Then you'll have an evaluation with me. Once I've trained some other people up to do it properly, we'll have tutors everywhere. Alright. Hands in your paperwork, blah blah blah. I'm going to stop saying that. Right, end of day 3. Go home, give yourself a treatment, reflect and write up the 3 days. Look at the explanation sheet, consent form. All this can be in recorded format, obviously, if you can't see. It's got to be for everybody, whether you can see or hear, or can't hear. So we have to cover all modalities. And then end of the day, before you sleep, review in your mind, visualize giving a great treatment, because it's next day is your last day. You're coming in for tomorrow, which is the beginning of day 4, and basically you're going to just do a full treatment to someone that you haven't met before. All being well, you'll be able to register your identification, your government ID stuff, and you get a license to practice for 12 months. Right, that's the end of that presentation. Not too bad. So what was it, 15 minutes to get through a 4-day intensive course. There you go.